Small up, small up.
Social distancing. All right. You ready? Good afternoon, all. I wish a happy new year, healthy, safe, and successful 2022 to all. Welcome to another Government of Anguilla press conference, the first for the year 2022. And before I go on, I just would like to wish congratulations to the newest members of the most excellent order of the British Empire, to Dr. Aisha Andrew, OBE, and to Permanent Secretary Mervyn Foster Rogers, OBE. Well deserved. Also would like to wish condolences to all those who are mourning loss of loved ones and those who are sick. I'd like to wish them speedy recoveries and want to thank you all for coming out today. I'll turn over to Minister Kenneth Hodge for opening prayer.
Thank you very much, Premier, and again I wish to extend Happy New Year to members of the media and those listening via the radio and social media. Dear Lord, we come before you today, this our first press conference of 2022. We continue to seek your guidance and your blessings upon us as we, the government of Anguilla, carry out the business of the people, setting our policies and programs for 2022 and beyond. We ask for your continued blessings upon this island and cover those who are currently suffering at this time. You know, many families have suffered losses over the past number of weeks. We ask that you continue to give them that strength and support to go through these difficult times. We ask your blessings on this afternoon's proceedings, that it go well and in order. We bring these before your name. Amen.
Amen. And just want to say welcome again to all who are here, to the ministers, the parliamentary secretary, the ministerial assistants, the chief medical officer, permanent secretary, and the Ministry of Health, you, the media, represented. We have Radio Anguilla, Lloyd's Live, the Daily Herald, the Anguillian, Dites, of course, for always being there to bring the press conferences, the House of Assembly, and we thank Dites for the continued work, and also our PRO and the liaison for the Spanish-speaking community. Thank you all for being here. Just want to say, of course, today restarts the day trip Blowing Point to Marigot ferry service. It's open for those who are fully vaccinated with a COVID test within 48 hours, a day pass which can be obtained at the Ministry of Health or at the port. Return same day or next day, test after the fourth day after you return. If staying out more than one night, then usual process to return to Anguilla would be apply on ivisitangilla.com with the testing necessary. Day trips continue to the Dutch side. Again, fully vaccinated plus booster more than 2 weeks, then no testing is required. Fully vaccinated, no booster, antigen test within 24 hours, PCR test within 48 hours. Uh, Day trip flights also possible to the neighboring islands. You would have to check what the requirements are for the island or country you're entering. Just want to say the budget address was done on Tuesday, the 4th of January. The budget debates start tomorrow, the 11th of January, scheduled for the 11th and 12th, starting at 9 a.m. And also, we know that the health of this country is of paramount importance. And so what I'd like to do now is just ask the members, ministers, and parliamentary secretary to say a word of welcome, and then we'll turn over to the permanent secretary in the Ministry of Health to give the health report. So we'll start with Minister.
Okay. Good afternoon, everyone, and Happy New Year. I hope it sounds different coming from me than from the Premier and from everybody else. But nevertheless, I do wish a prosperous 2022 on the entire Anguillan population and diaspora. We know that 2020 and 2021 have been particularly difficult, not only for in relation to the economic conditions, but also in relation to the raging pandemic. A lot of persons have been personally affected and touched by the COVID-19 pandemic, and outside of the COVID-19 pandemic, of personal illnesses. And I want to take this 2022 to really impress upon the Anguillan population to take specific attention and care to their health, to focus on preventative care, because we do know that that is very instrumental in preventing us having to rack up very exorbitant and expensive tertiary care bills. I've spoken previously about my personal experience, but I do know that many conditions which afflict Anguillians are preventative. Non-communicable diseases like diabetes, cholesterol, they all, well, not all of them, some of them can be hereditary, but you have an obligation or a responsibility to take care of yourself and to take care of your health. A lot of these things can be influenced by the way we eat and by the way we live. And so I have to encourage the Anguillan population to really pay attention to their health in 2022. We've seen how important health was in 2021. And so I just want to take this moment to impress upon the entire diaspora to live well, eat well, for their general well-being. Thank you.
Thank you. And I just want to say Happy New Year to entire Anguilla, those who are overseas who are listening via this medium. I too want to wish nothing but health and strength to all Anguillians this year. Encourage persons to take care of themselves. I think we need to return back to what we used to call community in our days growing up, where we begin to look out for our neighbor. I made the point the other day that sometimes you only get to see persons who live around us when we go to the church or to the shop. I think we need to look out more for our people, eat healthy and stay healthy, and above all, let us continue to uphold each other in this country. Happy New Year and blessings.
Thank you. I also would like to wish the people of Anguilla Happy New Year, much health and strength to all. I would just like to also say that from the Ministry of Economic Development that we have a huge agenda this year, and we look forward to the collaboration, the usual collaboration with the business community and the Chamber of Commerce for 2022. Just this morning I was listening to Lloyd as he was in Blown Point with the ferry, and I just want to put it out there that the Premier has been working to see how he can ease the burden on the ferry owners. So for 2022, we are taking a paper to Executive Council tomorrow that will waive the business license fees. We're hoping to get that approved on Thursday. So just to say to those ferry owners who would have paid their business license in 2020, who would have only maybe been doing the trade for 3 months, that their 2020 fee or their 2020 license will be basically transferred to 2022. That is something that we're working on to kind of ease the burden. So I didn't want to miss the opportunity to at least put that out there as I was watching Lloyd's live this morning. So just to say Happy New Year to Anguilla, to the people of Anguilla, and looking forward to working for them this year. Thank you.
Good afternoon all, and Happy New Year to everyone, and I hope that you had a wonderful Christmas, a warm Christmas. I don't know if it's already been done. My apologies for being late, but the OBEs in the house, out of the British Empire, well deserved. But I just want to piggyback on what Honourable Kyle Hodge have said about the ferry boat operators. The Parliamentary Secretary and I have also visited, and while it is slow, it's good to see that after 22 months, the ferry boat operators can once again embark on that trade. So we're here to answer any questions that you may have for us, and we're happy to see all of the bright faces once again, and we hope to see you continuously into the future.
Thank you. Just like to wish everyone a happy and prosperous 2022. This year is a year that we look forward to rebounding or continuing our rebound from COVID, particularly as it relates to our economy, and we are all looking forward to that. But I think as we move forward, socially, economically, environmentally, we need to be reminded that we're all each other's keepers. And this year, we realized that on the ending of last year and the beginning of this year began with some level of violence. And I hope that as a community that we can work together to confront that or combat that across different religions, political divides, and ideologies, that we are all either Anguillians or benefiting from the Anguilla the way that it is. So I really look forward to working with the community to find realistic solutions to address of violence. And especially this year as we move forward, I also look forward to us being more environmentally minded and friendly, and making the lifestyle changes and the decisions to protect and safeguard our environment. Thank you.
Good. Thank you all. And we now turn over to Merwin Foster Rogers, OBE.
Thank you very much, Premier, and other members of Cabinet, members of government, and Dr. Andrin. Before I invite Dr. Andrin to give her normal update, I want to say Happy New Year on behalf of the technical staff of the Ministry of Health, as on behalf of the team. Happy New Year and all the best for 2022. We also want to thank all the well-wishers who have been constantly reminding us of our OBE. And thank you so much for the kind words. It has been a hard 2 years, but it has been a 2 years where I think Anguillians have realized that this is a difficult period, but it's not insurmountable or unsurmountable. We are here as part of a team. We recognize that we could not do this by ourselves. We are a team in the Ministry of Health, in the hospital, on the ports, in the community, Royal Anguilla Police Force. So it's been a team effort to get where we are. So we recognize the OBE as basically something for the team. We have been the faces of the team. We have been in the forefront for the past 2 years, for the good and the bad. But we recognize that we're part of a team. We want to thank you so much for recognizing the team, and we share this as a team award. I want to not only thank the people who have supported us, but I want to thank the people who have been critical of us. We've given criticisms, and some of it quite right. You know, we accept our criticism, and some of it has been very harsh and wrong. But we thank them nonetheless because it motivates us. It motivates us to do better every day. And I want to thank all Anguillians for the support. I want to thank even people abroad who have been calling and congratulating, and thank the staff as well who have worked very closely with us, to ensure that we protect Anguilla and we protect all persons who live and visit in Anguilla. So thank you so much, Premier. These nominations are done in secret, so we had no idea who nominated us. We had no idea that we were nominated. And we were basically called at the end of the year indicating that this is the story. And we were just as surprised as everybody else. So we want to thank the persons who nominated us. We want to thank the persons who would have provided information on our behalf. And for your effort, we want to thank you so much for our recognition at this point in time. Dr. Aisha, you can now present.
Yes, I would like to echo the sentiments of the PS, and only to add not to underestimate the role of the political stability in a country and also the people. There's something in public health called the acceptability of any intervention. And if we didn't have the people behind us through thick and thin, through the most difficult moments, beyond having a good team, things just don't happen the way they should or the way you think they will. We had stability across two governors, a change of governors, and even political parties. And we're on all technical groups. This could have been so much harder, so much worse. Sometimes decisions that are made nationally are not necessarily according to the public health guidance. We saw a lot of that. This little team were thinking, my goodness, who are we and who will listen to us? But you did listen. And then, of course, the accolades and the recognition. In terms of tangible results came afterwards, which I'm all for. Deeds, not words, you know. The proof of the pudding is always in the eating, so to speak. So, I mean, it's been a phenomenal effort that has really involved the population as well. So it's many things that came together at the right time. We had the right people at the right time, including the population. So thanks for that. I can't believe we're still talking about this. You know, this is the third year of the, we're entering the third year of the pandemic. Wow. So, in all seriousness, just to talk about the global overview, first and foremost, up to the last epidemiological update of WHO, which was current to January 2nd, we're still seeing increases in cases. So now globally we're up to a roughly, let's see where that number is, wow, a total of something like 289 million cases and just over 5.4 million deaths globally. Our region of the Americas and Europe are still the ones leading in terms of new cases and deaths. Of those, in terms of the region of the Americas and our source market, the US is in the lead for that, most cases, most new cases. Then for Europe, you have UK, France, Spain, and Italy, right? So a lot has happened, a lot keeps happening. Things are evolving rapidly. There are some glimmers of hope going into the new year, hopefully. On the horizon came in early November the Omicron variant, and everybody was nervous about what's going on, all these mutations and trepidation and whatnot, and the travel bans came. That was first discovered in South Africa, and we've seen it now as a variant taking over the world, dominating the world over Delta, with more than 110 countries having confirmed Omicron at this time, right? So some of the glimmers of hope with Delta, with Omicron, and hope maybe the virus has thrown us a bone somewhat. We're seeing high infectivity rates. They're starting to compare to measles, which is like as infectious as you can get. So we saw beyond the historical variant, then Alpha, then Delta increase in infectivity. Now at Omicron, which is even more infectious than Delta, however, many indications are quote unquote milder disease. So that has been a glimmer of hope, and they're saying that perhaps this might be talking about endemicity in terms of having the virus around, but not as virulent or not as severe one. And also talking about this being the post-pandemic variant, so there's hope. But of course, with everything, there are caveats towards that. Just because of the sheer numbers of people being infected, you have the threat of overwhelming of healthcare systems, which we are seeing. It's less severe, but if it's infecting a lot more people, the numbers will still be racked up. Another area of concern is the pediatric population. Heretofore, the virus was seen as milder in kids and whatnot, but at least in the States and some other territories, they're seeing record increases in hospitalizations among children, so that's something that we have to watch as well. But one of the take-home messages that has been driven hard in the last few months is that about vaccination. Now with Omicron, we're saying, okay, maybe it's less severe, less likely to be hospitalized with Delta, but looking at that third dose, a booster dose in the first instance, in many instances, to sort of secure as much protection as possible from severe disease and death. So we're seeing that, and you're seeing even harder lines being drawn between vaccinated and unvaccinated populations. So that's where we are, hopeful, but certainly far from complacent. We still have to keep on doing what we're doing. We've seen a lot of changes with international guidance on how long you should isolate. Incidentally, we're doing 7 days in Anguilla, along with the UK guidance for those who have been confirmed infectious. We have seen a similar picture in the Caribbean with increases and real big surges as we start to see Omicron take over, big numbers, bigger than Delta, really. But so far, luckily, we're not seeing that concomitant increase in severity in terms of hospitalization and deaths. I say that to say now the thinking also among the experts is that we need to, we've said this from Delta, but even more now as we see these huge numbers, we have to start to look at a different metric to really assess severity, get over the numbers, and really start looking at severity and death as a better illustration as how well we are doing. In our own Anguilla, as of today, we have confirmed 1,942 cases. 1,789 of those have recovered, and a whopping 147 of those are currently active, right? So we have active cases to date of 147. You will note that I think up to mid-December, we were actually seeing a decrease in the cases. And then towards the last 2 weeks of December, we already noticed an uptick in visitors and people coming back. Lots more people were infected on arrival, and some subsequently when they were going for onward travel. So we're saying, so we were already having these discussions that it looks like Omicron was already here, right? So, and funny enough, I was about to, when I was preparing the notes, I was about to say up to December 23rd, the last 11 samples we sent for sequencing to CARFA from December 4th were all Delta. And it was at 11:33 a.m. this morning when we got the report from CARFA. The set that we sent on January 3rd, we sent 9 samples then, and 4, Omicron was detected in 4 of those already, and the rest were Delta. Just a share of those 4 where Omicron was sequenced, 3 can be thought of as imported cases still. It was 1 visitor from the US and 2 returning residents from this, that had been in the States coming in, right? But there's one resident with no history of recent travel in whom Omicron was also detected. So it's here, and we noticed that right on the heels of seeing the increase with the visitors, and we reported that to CDC, we were seeing it start to spread like a wildfire. I think from the 1st of January, we really started to see a lot of people turn up positive, albeit mild disease, so we said, uh-oh. So not surprisingly, and very timely, in a very timely manner, we have confirmed that there's Omicron. Just to note that our last deceased person, unfortunately, condolences to the family, the 6th case, death, we sent his sample and it was Delta still. So, and that is in keeping with the thinking that Delta is still causing more severe disease. Let's see how far that goes, right? And so looking at now our vaccination coverage, and again, a take-home message, that's all we have at the moment, public health measures and vaccination. You would note that recently the UK JCVI, the council that gathers to give advice on immunization, they have now approved for the lower age levels of 5 to 11. So we're just going with that, and we're doing the logistics planning. The UK has come through consistently with our vaccination program. As of January 5th, we had 2,057 doses of Pfizer administered. We're looking at having given a first dose of roughly 37% of our 12 to 17-year-olds. And we continue with our boostering and so on. Right now, our vaccination coverage overall in terms of complete vaccination is still somewhere around 60 to 61%, so on. The vaccination schedule is posted online. Let's see if I can pull that up for you on our Facebook page. This thing kept freezing. Yes. So you can find that with Welch's Polyclinic. The Pfizer first doses and booster walk-ins, that's Thursday, January 13th, between 10 a.m. and 12 p.m., and then 1:30 to 3:45 p.m. And then on Friday, Pfizer first doses and boosters at 1:30 p.m. to 3 p.m. And then the Pfizer second doses by appointment. You have to call in for those, and that's going to be Thursday, January 13th, 9 a.m. to 10 a.m. And then for the first doses and boosters at Western Polyclinic, which are doing only appointments, that's on Friday, 1:30 to 3:45 p.m. for that. Let me give you those 4 numbers. For Welch's, it's 497-4020 or 497-4503. And then for the Western Polyclinic, it's 497-6421 or 476-6392. Right. So now we're looking at the logistics towards the vaccination of the 5 to 11-year-olds. We're also in discussion with education and the school health program to look at boosting up the vaccinations there. See, is there anything else worth mentioning now before the questions? I think that's the main part. I'll just wait for any questions.
Question?
Mhm.
From the Daily Herald. Congratulations again to both of you and your team. My ears, I guess, I'm out of practice. Could you just go over the numbers as of 5 Jan? How many people are vaxxed? I didn't catch that.
Okay, let me see. The overall, January 5th. Oh, I have a more recent update, actually. Where is it?
It
I
was
want from
two-
January 7th. Okay. As of 4 p.m., January 7th, we have first doses of vaccine, 10,157. Second doses, 9,282. Total Pfizer distributed, 2,259. Of those, you have some first doses, 598, and second doses, 54, and boosters, 1,607.
Okay. Couple other things. For the kids that are vaccinated, apparently they're only getting a card, a paper card, and not the type of vaccination card that we get. So for travel, will a laminated card be given to the kids eventually?
We're looking at that because, I mean, this thing has dragged on longer, and I know that the cards are well received internationally, all over the globe. It's nice. So we're looking at that in terms of this year and planning our resources. We would love to keep those cards for everyone, you know. So we're looking at those kinds of things and the different variations, laminated cards and the ones, the ID with the big picture and so on. Yes, that's
Okay.
our plan.
Okay, and there's lots of questions, so just one more thing, just a comment. I used the iVisit portal recently, and I just have to thank you and the developers of it. It has morphed into something that is very easy to use now, at least for people like me, and much faster, so thank you.
Just a quick question. Dr. Andrew, you just spoke about the presence of Omicron, which is no surprise, and the surge in the numbers. I'm just wondering, are the increase in the numbers more related to tourists than locals?
In the beginning, the first indication that it was here was in the tourists arriving. We saw a lot more people testing positive. And then now, subsequent to that, and I would say this following week, we really started to see the numbers really taking off locally as well. So it's no surprise that we've confirmed, and even the one that with no travel history is already here. It's extremely infectious, so yeah, I mean, that's what's going to take over in the next few weeks. That said, what the countries have seen are, besides not necessarily seeing a big boost in your hospitalizations and deaths, they've seen that the surges are quick, a sharp rise and a sharp decrease, so let's see. And we're seeing huge numbers elsewhere, so that 147 right now, I mean, every day that we can continue doing what we're doing is a victory, and we just have to adjust our sense of what is the new normal, so yeah, but pretty much is here, definitely, yeah.
If I can just add to that, if you recall when we were here last year, when South Africa had indicated they were having an issue, South Africa's already on the other end. Their numbers now have beginning to decline in terms of Omicron. They begin to stabilize because the numbers just go up rather quickly, but then they tend to stabilize rather quickly as well. We're going to see that in other countries. It is a different virus in terms of the mutations, quite a few mutations. And even the symptoms are even a little different. And it seems as if the infection may no longer be deep lung, but now somewhat in the upper respiratory tract, nasal cavity, and those type of things. So we're hoping that, and I think there's one virologist that is referring to Omicron as a natural vaccine. So we're hoping that, that it can begin to peter out, as Dr. Andrew said earlier, where it can become endemic, where, you know, you go around and it's not really causing too many deaths, but we would probably have to be sure that we're protected quite often. So we're hoping that this is the beginning of the end. Hopefully that by next year we'll be beyond coronavirus as a pandemic, as we've known it for the last 2 years.
Follow up on
Sorry, just before we get to that, just the other caveat there would be not just with the pediatric hospitalizations, but also the question of long COVID. We're not sure how it will do there. So again, the call to not being complacent yet. Things are looking hopeful. Maybe there are more opportunities than the challenges with this one, but we just have to be a bit more patient and keep on doing what we're doing, because there are some questions still unanswered that will only be answered or confirmed with time and more data. So.
on a question that was posed earlier in reference to the cards for the adults. the booster, when will that be added to the card itself instead of having this little paper thing to walk around with?
Good question. We actually would have had it done before, but there was a glitch in the system. We migrated from one system to the next, so we're now ensuring that everybody's boosters are entered in the system. We have to do it manually, so it'll probably take another week or two, but we're ensuring that that is being done. When we transfer from one platform to the next, we did have a little glitch with the data, but we will ensure that that is transferred. So when your QR code is read, you not only see the two original AstraZeneca doses, but you'll see the booster as well. And that is what we're working on now. So it's not that it wasn't supposed to be, it's that there was a glitch in the system, and we now have to back up and do it manually.
You made mention in reference to the 5 to 11. You don't have an idea in terms of how soon that would be rolled out to Anguilla?
Not yet. We probably will give you a better idea of that on our next meeting next week.
I didn't quite follow what you were saying about the boosters. I had understood when I had my booster that they were putting the information on the card then into the QR. They did. Okay. No, you were saying that you're still working on it.
There was a glitch in the system, so that initial information was not entered.
Right.
Or it was entered and then it was lost.
Okay.
So we don't have to go back in and do it manually.
Okay.
But yes, it will be.
It will be in. Thank you.
Mr. Rogers, are you pleased generally with the numbers in terms of persons taking the opportunity to be vaccinated?
No, I think the numbers could be higher. To be honest with you, when France started out, France was much lower than Angola in terms of the numbers, but France now has upwards of 80-90% of the people vaccinated. I don't see why we can't get to that level. There are many countries that start off slow. If you look at Canada, Australia is up to 90%, I think. So we can get there. I think, as I mentioned before, people are now beginning to realize that yes, this is something serious. I mean, we went from 1 death now to 6 deaths, and if you look at the numbers, most, if not all, I think we're querying 1, are not vaccinated. Even the numbers in hospitalization, even in numbers in general positivity rates, we see the numbers very much higher and unvaccinated. Even in the U.S. today, if you look at what's happening, it's mostly in unvaccinated. Even though the vaccinated do get coronavirus, the outcomes are not as severe as those persons who are not vaccinated. So I think the evidence is there. I think we have to ensure that persons keep getting the information, that we keep reminding persons it's not only their civic responsibility, but it is their personal responsibility to ensure that they protect themselves and they protect their families. So we think the numbers could be higher, but at the end of the day, everybody has a personal responsibility to ensure that he or she is protected.
Vaccination rate among the children, are parents receptive to that idea?
It depends. I think in the high school in particular, we would have been happy with some higher numbers. The numbers in the high school hasn't yet hit 500. In fact, far from 500. Where in the high school in particular, we have over 1,000 students. We would want the numbers to be high as well. There is a lot of misconception that the vaccine will hamper reproductivity of young ladies and hamper sperm counts of young men, and this is certainly not the case. So there have been some hesitancy, I think, from some of the parents. But we would like all the persons in all the school levels to be vaccinated because it is a protection. We have seen in Angola in particular most of the cases of the last couple of months, a lot of them have been school-age children and younger children. In fact, most of the outbreaks, if you remember last year, were in school children, daycare settings, and homes. It wasn't the bars and it wasn't the strip that we were seeing fueling these numbers, contrary to popular belief. So if you look at what was really happening, then I think people should be concerned that they get their children protected as soon as they possibly can. I don't recall. I think it was somewhere June, somewhere, yeah.
Mr. Rogers, we just had a resumption today in the ferry boat to the Marigold port. I know persons were somewhat surprised knowing that St. Martin currently has a state of emergency. Do you foresee any problems there in the future?
Well, COVID is everywhere. I mean, I just came back from the US. You know, what do? Life goes on. We are a small community that trades on travel. That is our stock in trade. Persons come into Anguilla for leisure. Persons have to go overseas for medical attention. Persons have to go overseas for other personal business. The world continues. And I keep, from this podium in particular, over the last 2 years, I've been saying, you cannot have a healthy population unless you have economic health. They must go hand in hand. And we have to pay for medications, we have to pay salaries for doctors and nurses, we have to pay, persons must be able to pay for proper food as they go to the supermarkets and so forth. So you must have a thriving economy for persons to be healthy. And you can only do that by allowing persons to travel, come and go. St. Martin in particular, as we know, we are only allowing persons who are vaccinated to travel. And when you return, we do a day 4 test to see your status. And we think this is, at this point in time, is the responsible thing to do. We are allowing day trippers to come for the day. You must be vaccinated, you must have a negative test, and you go back the same day, which will again fuel our economic development here in Anguilla. So we are taking baby steps. We are not just throwing caution to the wind. We are doing this in a way that we think is responsible. We're doing it in a way that we think we can manage, so that at the end of the day we can have a robust economy, but at the same time a healthy people.
Any other questions for the health team? Anything online?
Well, that coming out of Cyprus, but I haven't gotten the details, and even questioning whether it's valid. If we'll just see, you know, and make no mistake, it raises an important point. Every time there are missteps where it comes to vaccination and this sort of inadequate response, you're going to have more and more variants emerging. We just have to be grateful at every step of the way. It could always be worse, for real. I mean, but if we continue to do this piecemeal vaccination coverage across the world, we're going to be in trouble. We're going to continue to be in trouble. You might look at Omicron as a godsend. I mean, if we can't do any better as a population and it doesn't get worse, but there's always that possibility you get another variant, a more severe variant that completely is not responding to the vaccine. So that's a risk. That's a possibility, yes. So.
When the vaccines for the 5 to 11 roll out, will you consider doing it by school in a mass area?
We're working on all those things. We're going to look at high-risk kids, and then what is our plan for the sort of persons not at risk. So all of those things that we are discussing, what's the best way to roll that out. So, yeah.
In terms of the virus mutating, make no mistake, that is what viruses do. All day they find a way to either escape immunity by changing their genetic makeup or somehow make themselves more sustainable. That's the only job. Viruses do not have a brain. They don't think, but they're just every day, as they mutate and as they change, find ways of escaping immunity. That's all they do, right? So make no mistake, we're going to have more variants. We're going to have more changes as we go along. But the idea is hopefully that person will have enough coverage in the community, whether through immunization or otherwise, so that we stop the virus from spreading even further. But it will change. That is what they do.
Thank you very much. So if no further questions for the health team, I will allow them to leave and get back to the business of keeping us safe. Thank you again, and Happy New Year. School is in, so I will turn over now to the Minister for Social Development and Education.
Thank you. Thanks to the health team. It has been a long time coming. We've been trying for many, many months to get our children back to school. And today we finally have opened our plans to allow all of our students to go back to school. Of course, we reinforce the need to implement our protocols in relation to COVID-19. So that's mask wearing, where we cannot socially distance, and this is something that has come up time and time again. We have indicated that there will be instances where you will not be able to socially distance in the school plant because of the way the classrooms are set up. And in those environments, we have re-emphasized the need to wear masks, to frequently sanitize, and to have our custodians go in and clean the classrooms. That is paired with our constant advice to our parents and our students to get vaccinated, because the vaccine is available for students between the ages of 12 to 17. And we've been impressing on parents the need to vaccinate their children. And then we've been pairing that with, of course, keep healthy, keep your immune system strong. So one of the very important changes that we've been implementing for this term is we are going to be implementing testing on site. So we have our school nurses who are being trained in terms of the testing, so that if we have a child who appears to be symptomatic, they can be tested at school. Of course, I want to pause at this moment to remind everyone that every single school year, without fail, the school administration asks parents if your child has any flu-like symptoms to keep them home. This is not the first time. COVID is not the first time that we've been impressing upon parents to keep your children home if your child has any flu-like symptoms, if your child is coughing or running a fever. We have repeatedly asked for decades, keep your child at home. Our experience over this COVID-19 pandemic is that when we have had breakthrough cases in the school, it has happened because we have had symptomatic children come to the school. So that means there have been children who have come to school with runny noses, they've been coughing, and they left home and they came in the school with runny noses and coughing, and that is how it has spread in the school. So we've been asking parents to follow the advice that has been decades old. If your child is symptomatic, has any symptoms at all, please keep the child at home. That is for to maintain the child's safety and the safety of other children, and to ensure that we can keep education online for as long as possible. We know that education is extremely important, and we've seen overseas schools that have resisted locking down regardless of surges, regardless of cases. They've continued to push through. We have tested the temperature here in Anguilla, and we know that a lot of parents were not comfortable with us doing that in many circumstances. But at this point in time, we are now at a stage where we have to seriously look at the learning losses that have been faced by our children, to ensure that our children are being adequately educated at this point in time. So I can't emphasize it enough that if your child is symptomatic, please keep your child at home. And this is whether or not the child is at daycare or preschool or primary school or high school. If your child is symptomatic, please keep your child at home. I mean, of course, that also follows with, please get your child tested, but that's the logical next step. So I am very happy to see our students back at school. It's something that we have been trying to accomplish for quite some time, and we're now here, and it is something that we are going to fiercely protect. So I would like everybody to be responsible still in light of the COVID-19 pandemic, so that we can keep education going. That's all for me in relation to education. If you have any questions, I'm here.
No questions? All right. Well, well, thank you. I'll go now to the Minister for Home Affairs, Labor, Immigration, Physical Planning, etc.
Thank you very much, Premier. I just wanted to give some general updates. Since the beginning of the year, we've been meeting with the Ministry and Department to discuss our plans forward for labor. And very soon, the Department of Labor is going to be rolling out some education initiatives where they'll be seeking to inform workers about various aspects of the law, various aspects about the operations of the Labor Department. And we are hoping eventually to roll these across Facebook, radio, and print. But within the coming weeks, there will be some of this, most likely starting with social media and then expanding to radio and print. I just want to indicate as well that as Minister, I've been getting complaints from workers about mistreatment, abuse, unfair treatment of local staff at hotels. And just recently, the Premier would have written a note to all the major properties outlining government's concerns about these reports. And at the Labor Department, we will be shortly undertaking some site visits to the various properties. We'll be meeting with senior staff, that is locals and expat workers, to have discussions with them about expectations of their performance, their conduct, the way they should be operating. And we'll be also asking for an opportunity while we are at the hotels to create a safe space where we can also engage with the lower level workers so that they too can speak of their experiences if they are experiencing issues of abuse and so forth. So we'll be engaging in that shortly. We are not going to tolerate abuse of workers in the workplace. We are continuing to undertake reviews of the Labor Relations Act and other related policies to ensure that we give the labor legislation as much teeth as possible when these issues come up. The last issue I want to deal with quickly as well has to do with terminations or redundancies. And I'm encouraging all workers who may have experienced a termination or redundancy. Your first port of call really is the Labor Department. Under the law, there are provisions under the law that speaks to this, and I would encourage all workers who are experiencing abuse or who have been terminated or made redundant to please come in to the Labor Department to have this issue noted and investigated. At the end of the day, sometimes these issues escalate upwards, either into the courts or tribunals or other forms of action, and so we want to get it, basically encourage workers to take the right steps from the get-go. It is within the rights of workers if they wish to go on social media or radio, that is their right. But I'm encouraging them under the law to come into the Labor Department so that these issues can be dealt with. That is it in a nutshell. If you have any questions, I'll be happy to answer them.
Mr. Haji, you made reference that you would be going to the hotels and speaking with the staff in reference to the grievances and the challenges that it would be having. From my experience in the past, it's not really productive in the sense that those same workers feel intimidated, and therefore they won't realize it wouldn't be a true setting for them to air their grievances. And so therefore you wouldn't really get a true picture of what they're going through. They wouldn't want to tell you amongst other people. So I think you should try next method.
Well, I will let you know as well, Lloyd, that last year we would have undertaken an investigation at a property where we would have met with workers to discuss issues at that property. We compiled a report and remedial actions were undertaken by the property. So it does work. In terms of persons who may be afraid, they can come to the Labor Department outside of work hours, so that avenue is open to them, but we are conscious that we want to give that opportunity. So if the persons are not comfortable when we go to the property, they can come outside of the property to the Labor Department. Yes.
A quick question. So could you tell us the frequency of these complaints? Is it like a 5% increase over the last 2 years, a 10%, or is it just out of control? Could you tell us the enormity or the non-enormity of this issue, please?
I can tell you since coming to office, I've been getting those complaints, even during the campaign period and coming to office. So they have always been ongoing. We have this glass ceiling, so to speak, where it's a perception that this glass ceiling is there that keeps Anguillan workers from being able to achieve significant attainment in the hospitality sector. And so that is why we have to ensure through our understudy policy and other initiatives that we create the cadre of highly trained Anguillans that can challenge and shatter this glass ceiling. But this has been around basically since I know myself, that the perception is the properties don't want to hire locals, they prefer to bring in their own people. But we have to do that through education, through training, through the creation of policy.
It's not just the hiring issue, it's because you talked about abuse initially and firing people.
There are reports of abuse, yes, and once they come in, we will investigate them, yes.
Any other questions? I do know that, most of the complaints we see on social media, certainly the persons that come in to the Labor Department, and those are taken seriously, they're investigated, and actions are taken when deemed necessary. And the minister is, Lloyd, I know you say that going down to the properties and meeting with the workers doesn't work, but I remember in 2014 when the former Chief Minister, Mr. Hughes, went down to Viceroy at the time, which is now Four Seasons, and set up what's called a safe space. That is, and I think Minister Hughes, you remember that, where we basically, the management was not allowed to be in that room, and the workers were able to air their grievances. And it was, I think it was a good meeting, and it informed decisions that were made at that time. And so I think if, there are no trade unions for the hospitality workers, and that might be a good way to go, and the minister has talked about collective bargaining and coming up with legislation for that in this year. But I think that the workers do need to represent themselves, and certainly they know that they have advocates in this administration. And if they meet any one of us, whether it's ministers, Paul Sec, ministerial assistants, the PRO, the liaison for the Spanish community, if they give us any ideas of what's going on, we do look into it and make the necessary decisions. So that is what we want, all workers, not just hospitality workers, but all, that we do look out for Anguillians. And certainly we see on the internet, where some property may have advertised that there's someone coming in, and that started an uproar. I don't know if the minister wants to give any update on that situation, just to allay the fears and concerns of the general public. I was talking about that social media post where there was a human resource person coming in, and what the situation is.
Right. So the Director of Human Resource was recently let go from Aurora. I would have spoken with the individual. I advised her to come into the Labor Department to, again, register her complaint. But there seems to be a mix-up out there on social media. And I recall at the beginning of this year, I said to someone, let this year be a year of truthfulness. When we are sharing information to the public, at least make sure it is truthful, do the research. So there's a position, so at Aurora, they have a pretty large human resource organization. It's a very large organization. And they have a number of overseas-based persons that operate, come in occasionally, and because they come in occasionally, they have to take out a work permit. The previous holder of this position, which is a position called Director of People and Culture, would have recently resigned, and they appointed a new person in that position. But specifically to the Director of Human Resources, that is a position, let me be very clear, let the camera focus in on me directly. That is always a position in any of the properties that will continue to remain the purview of suitably qualified Anguillians. I mince no words with that. And so, if you look across the sector, you will see that Anguillians are in these positions, and where they are not as yet a qualified Anguillian, there's someone in there as an understudy. So that will always remain the purview of Anguillians. And we say that because the workers who have to be dealt with by Director of Human Resource, being an Anguillian, and gives you an opportunity or an ability to deal with the Anguillian workers, because you understand them, you are part of them. And that is why we insist and we ensure that any position relating to Director of Human Resource must be an Anguillian. But as I said, many of these properties, because they are so large, they have expanded organizations for human resource. And in this particular case, they have one or two US-based persons who come in occasionally, and because they come in occasionally to visit Anguilla, they have to take out work permits for them. I hope that answers the question.
Just a quick question here, because I'm not in the hospitality industry at all. I have no idea. If a hotel wants to fire somebody, do they have to do it through the Ministry of Labour? Do they have to come to you first and explain the whys and wherefores, or are they at liberty just to fire and hire as they like?
No, they're not at liberty, not a liberty, Brenda. The Labour Act provides clear guidelines in terms of the process of firing or terminating. It is very clearly laid out, and it is done in consultation with the Labor Department. So, no, it's not a willy-nilly thing. And as you say, these things can escalate into legal issues down the road. So, employers who are having issues on the job, I advise them to come in and seek advice from the Labor Department when they are thinking of taking steps of redundancy or termination. And I'm not here making any apologies or excuses if persons are not performing, if they're not giving the employers a fair day's work for a fair day's pay. But at the end of the day, the Labor Relations Act provides all of these steps that one takes in these cases.
Okay, good, thanks.
What's the difference between the role of HR director and people and culture?
The organizations, the properties, each of them in some instances have larger or smaller HR organizations, depending on the numbers of persons. But in terms of your question in particular, we were asked for and we would have received job descriptions for these various positions. And we have had meetings with them. And what we are being told, what we've been shown is that these different areas have different functions to carry out. There's been some changes recently where they are moving more away from human resource to more leaning towards people and culture, yes. But at the same time, we are insisting that at the end of the day, whether it's called people and culture or human resource, we are keeping those positions open for Anguillians.
Thank you very much, Minister.
Thank you.
If you can pass the mic down to the Minister for Infrastructure and Tourism, and you update us, Minister.
Good afternoon, everybody, and thank you, Premier. Firstly, an issue that has come up very often recently is persons utilizing the back street road in South Hill as a two-way road. That still remains a one-way street. Perhaps signage needs to be updated, but quite a few people have been traversing that road going from east to west when the road is only from west to east. So by way of this medium, I'd like to admonish persons to utilize the road in a proper manner. It has caused a lot of stress, not only for the residents in the area, but also accidents and near accidents. So hopefully persons can adhere to that. I also would like to speak a little bit quickly to the hotels and hoteliers that, especially on the beach. As Gabby said in Barbados, these beaches are mine. We can bathe anytime. And I say that because there have been some instances where hoteliers have asked security to remove persons from the beach. And persons who have been peacefully on the beach, and we hope that that practice will stop with immediacy. It is something that we will not tolerate. All of the beaches in Anguilla, save for two, are public beaches. And just for clarity, the Sandy Hill Beach and the eastern side of the Shoal Bay West Beach are both private beaches. Apart from that, all other 33 beaches in Anguilla are public beaches, and persons can visit those beaches at any time without being disturbed, enjoying the beach and enjoying the water that is affixed to the beach. That aside, as persons may know, recently we sent out a communique stating that a small pier in Sandy Ground is closing. A number of individuals, I shouldn't say a number of individuals, 3 individuals in particular, have stepped up to the plate to purchase materials to the tune of over $5,000 to do repairs for that wharf. We will evaluate it. We won't say that we will reverse the decision, but we will evaluate it as we move forward, because that pier has become a serious hazard. Not only is the wood on top of the pier continue to deteriorate, as soon as you replace one, another one deteriorates, but also the piling under the pier is falling apart. I've asked the persons within my ministry who's tasked with maritime and also the Anguilla Air Seaport and Seaports Authority to consider looking at an RFP, given the fact that we have financial constraints in terms of major infrastructural works, to look at an RFP where we can administer an RFP with build, design, operate with that possibility. Looking forward, as we would like to have a pier in that area, and also a pier that can facilitate small craft. And that is something that is important for not only for our local boating community, but also for tourist product. As you know, the Valley Main Road is progressing very well. I visit the Valley Main Road literally 7 days a week, because most of the week, including weekends, the contractors are on that road doing work. So tomorrow, on the southern side of that road, south of the Social Security junction, they will start paving the sidewalks. All of the curbs are already in. The bus stop is already in. They will start paving the sidewalks, and also they will start the footings for the runabout at Parliamentary Drive into the old Galaxy area. So we're very happy about that. And then later in this week, they will start paving the actual southern side of the road. The northern side of the road is still finishing the curbs and so forth, so they're moving quite rapidly along the way. We seem to be a little bit ahead of time, which is really good. We can always celebrate when we're a little bit ahead of time as it relates to these matters. The road to the new Albina Lake Arch Comprehensive School. I visited Agent T today, so it's still on my mind. To the new Albina Lake Arch Comprehensive School, the tenders went out. They're going through the process of evaluating right now, and hopefully that tender will be granted soon so that that new road can be installed. As it relates to ALIF and the airport, as you know, we did quite a bit of remedial work at the Clayton J. Lloyd International Airport Terminal, and we're still doing some work in terms of the testing area, the area in which we have erected to do testing, but we found we were able to do on the arrival side to establish a makeshift testing area, which I've seen in operation, including this past weekend. And I must say that customs, immigration, the testing team, they did a magnificent job over this weekend, moving people through quickly, doing the testing, making people feel comfortable. And that is the type of service that we need to ensure that we give to all our customers, whether they be returning residents, locals, visitors. That's the type of service that we need to continue and be consistent with. That is the type of service that's going to change the way many of us feel about the services that are rendered here in Anguilla. American Airlines, as you know, they started 3 flights a week. They have gone from 2 flights a week to 3 flights a week, and it's going well. It's full capacity, which is great. It is great not only for Anguilla but also for the airline, because airlines are not here to give us a social contribution. They're here to make a profit, and a profitable airline flying to Anguilla is also a good thing for Anguilla. So we're very happy with that. Air Anguilla Services and Trans Anguilla, Cape Air, Tradewind Aviation, Air Sunshine, and Sky are doing well, and that is a good thing for Anguilla. So it'll be curious to see what the tourism statistics look like for December and January of this year, December of last year and January of this year. I believe they'll look pretty decent. And based on what the feedback that we've been having from the hospitality sector, it seemed as if it was a pretty good festive season. The Blowing Point Ferry Terminal, the Parliamentary Secretary and I visited the Blowing Point Ferry Terminal today, and the Blowing Point Ferry Terminal is going extremely well. I was very impressed in the speed in which they have erected the walls. So the walls have been erected on all sides, and including the partition walls, so they're moving very well as it relates to the Blowing Point Ferry Terminal. And as you know, day trip started today. I just want to say that the protocols that has been established isn't only protocols that has been established in Anguilla, but there are also protocols that have been established by the French authorities, which we have to abide by. I've received a significant number of calls from persons questioning the St. Martin protocols, and we have no jurisdiction over St. Martin. And like I said to them, and I like to say here, that we cannot tell St. Martin, make demands of St. Martin how to establish their protocols to protect their people. Yes, it is, they may have COVID numbers, but that is beside the point. This is what they have established, and we have to abide by their protocols. And their protocols are that persons must be fully vaccinated, and no unvaccinated crew, no unvaccinated captains, and no unvaccinated travelers will enter their jurisdiction. One other thing to note is that the French is not allowing cargo to be placed on the ferries. If persons go to St. Martin and they shop for bulk items, cargo, whatever it is, it must go to Galles Bay and then on to Anguilla. It cannot go through the ferry. They will not allow it. So I just want people to know that and understand that. That is, again, not our call. That is the French authorities' call. And we cannot tell the French government in France, who gives the directives to French government in St. Martin, what to do. That aside, one of the issues that I will be addressing very shortly, along with the Commissioner of Police, and I must say that I addressed this with the Commissioner of Police before, and I want to address it with the Commissioner of Police again. So on Friday, we are slated to meet to discuss litter and the Litter Abatement Act. We have a Litter Abatement Act in Anguilla that it has been on the books for several years. But it's all well and good to have legislation on the books. But legislation without enforcement is nothing but a piece of paper. And I have been admonishing commissioners of police and leadership in the police, Royal Anguilla Police Force, for well over a decade. And there have been several cleanup campaigns led by many members of our communities. There have been the Anguilla Enhancement Project that has led in, enhancement drives in Anguilla. And yet we see trucks driving uncovered, violating the law. Yet we see persons throwing bottles and cans out of their windows. And I want to know, when we talk about national pride, and when we talk about Anguillan and Anguilla first, and when we talk about preserving our environment, how can we say we love Anguilla when we litter in the manner that we litter in this country? There have been some areas in Anguilla that has become dumping sites over the hill that leads over to Santa Ground, that has become a significant dumping site by unpatriotic Anguillians. And this practice needs to stop. People have to take personal responsibility. We are saying that we want a clean and pristine island, but you dump in your garbage, and then you're complaining when the garbage is out there for somebody else to pick up. So we also have to take personal responsibility, but I'm admonishing the Royal Anguilla Police Force. Every single one of the members of the Royal Anguilla Police Force is a little warden. And so we need to do better in this country. We need to do better. We cannot have persons coming to our island, visitors coming to our island. And I see it on social media, I see it on Instagram. Visitors to our shows, tourists to our shows, cleaning our island up. Significant piles of garbage on our beaches, cleaning it up. So, and yes, on some of our beaches may not have the requisite receptacles, but if you go to the beach to have a picnic, walk with your garbage bag, put your garbage in the garbage bag, throw it in the trunk of your car and find the closest receptacle. So these are things that we have to do for ourselves, you know. If everybody in Anguilla continue to do what we're doing as it relates to garbage, this island will be one of the most filthiest islands in the world. If we were talking about luxury tourism, then we need to take personal responsibility, because tourism is key to our survival. And the recent COVID pandemic, when Anguilla was closed down, demonstrates clearly how important tourism is to our national survival. So this is something that really irks me and upsets me, because I've participated in way too many cleanup campaigns on this island. So that said, I just want to say there's another area in which we need to address, and I have written to the Director of Agriculture and other agencies within government about animal control. There are too many persons in Anguilla who have been trying to conduct backyard gardens or even ornamentals, and we've had goats and sheep destroy their plants. We've had persons who have gotten in accidents trying to avoid goats and sheep. And also, on the other side, we've had stray dogs who've destroyed people's goats and sheep that has been kept in the manner in which they ought to be kept. So we need to do a little bit better as it relates to animal control as well. So that said, I'm open to any questions if you may have.
Very quick questions. I know Minister Kyle Hodge left, but I was asked to get an update on the dolphin discovery effort. So, Minister Hughes, if you could talk to that, fine. If not, I'll just wait until next week to ask that question. That's question number one. And question number two, the road to the Albino Lake High School. Is this a new road? I think I asked that before. It is a new road? Okay. Is the footprint out yet, the design yet?
Yes, the tender has already been completed. It's going through the evaluation. It's in the latter part of the evaluation. It should be finished hopefully within the next week or so. They should issue a contract, or at least They should allow the contractor to know, whoever the winning contractor is, that they have won the bid to install that road. This is a significant road as well.
Great. And can you talk to the dolphin discovery, or should I wait until?
Yeah, it's best to wait until next week.
Thank you.
Well, I can speak to that. At the moment, the previous owners, are in discussion with the minister, and they should be coming on island at some point in the very near future for further discussions, and also to evaluate the area down in Blowing Point. where the dolphins were kept before.
One road that you didn't mention, in Sandy Ground, I understand that the road to the new jetty is the problem, and that's why the jetty hasn't been opened. So
That is not correct.
that's not true? Oh,
No,
okay,
that
that's
is
what
not
I
correct.
had
First,
heard.
the jetty needs some time to cure. The concrete needs time
Oh.
to cure. That's one. And the road has already, we have acquired more land to develop the road there. But that is not a problem. It just needs some more time to cure. Once that is done, then that facility will be open, and it should be shortly.
Okay, thank you.
You're welcome.
Hey, you made mention of 2 private beaches. But I was about to ask that question, how and why?
On the eastern side, where Blue Waters is, that area, that is actually a private beach. And Sandy Hill, there's also a private beach. Sandy Hill Beach. Yeah, it is a private beach, but the owners just don't prohibit persons from utilizing it. But if they choose to, but thank God they haven't.
I want to thank you all. If there are any further questions?
No questions, Fee?
Brenda, you're always taking over the conference, Go ahead.
So on January the 7th of this year, the edition of the Anguillian, I'll just wait until this phone alarm goes off. So I'll start off again. The Anguillian's edition January 7th, of this year, ran a 3-page article written by QC lawyer Tommy Estefan entitled "The Time of Reckoning is Upon Us." And he writes in great detail about the numerical some facts. And I'm going to quote him: "The lush sums of our monies paid from the Anguillian Treasury under the legislature's Pensions Act, which was passed in 2004, to 17 retired ministers of government of Anguilla, who have not paid a cent or a farthing, as he says, into the pension fund from which they now benefit, totals as of, I think, November of last year, $13,760,770.32 EC. He writes that all 17 former government officials have paid exactly $0.00 into the pension fund, and any other fund from which these hard-earned Anguillian tax dollars are now being paid to them. He ends the article by saying that the government of Anguilla must end this madness and go to the House and repeal this act in its entirety." So, Premier, as the Minister of Finance, could you tell us how you intend to deal with this?
We sought legal advice when Mr. Estefan QC brought this up on Cool FM radio some months ago. We sought legal advice, and the Attorney General's chambers says that we can repeal the act, but it still wouldn't affect those who are now benefiting from it, because you can't retroactively remove their pension. Yeah, and so that's the concern there. The other consideration here is that there are civil servants who prior to 2004 didn't contribute, who are also getting pension. And so these are all concerns that have been raised, that we have been looking into. Certainly these are legal issues, that we have to take advice on. And so, as I said, we have discussed this with the Attorney General's chambers, and we'll be looking further at this. We did campaign, this administration, that we wanted to set up a contributory pension for legislators going forward. That has to have actuarial review to determine what the contributory rates would be, and so that is something that we're looking into.
Thank you.
You're welcome.
The website in December, we've had a number of unfortunate deaths. I'm just wondering, what is the impact on government's budget when we have to bring in a pathologist?
That is a significant impact on government because there is certainly, it is budgeted for, but we certainly exceed that, and it's unfortunate, and we have these untimely deaths that have to be, evaluated by the pathologist who comes in from overseas. The senseless gun violence resulting in death, auto accidents, unfortunately, that do. Some persons who pass, where it's not necessarily easy to say it's from natural causes. And we always exceed the budget. We have looked into, training our own pathologists. There are several doctors that have been trained using the taxpayers' money, and I'd say most of them do not return, and that is a concern. But also we haven't had anyone at this point in time who has decided that pathology would be their specialty of training, even though, as I said, it is one that is being considered. We do know that these are necessary. It's a necessary evil to have to do autopsies on persons who have untimely deaths. But it's something, again, as I said, we want to advance to that stage where we can have our own homegrown Anguillian goes off and trains and come back as a resident pathologist. Something, as I said, that the permanent secretary has been looking into and that we have been discussing.
You said that that's an area that is usually budgeted for, but we have exceeded that. Could you tell us what are the figures like?
Can't recall off the top of my head, but I must say that it is exceeded very quickly. And one of the things, when Princess Alexandra Hospital was upgraded after Hurricane Irma, a morgue was put in, refrigerated area, where the bodies could be kept until the pathologist came. And that area was supposed to be set up also as a place where the autopsies could be done to save on cost. At this point, it hasn't been functional, but that is the goal, that it would be made to that. But I can say that no matter how much we have put in, budgeted for it, and we raise that amount every year, it still gets exceeded. And so it's a serious consideration we have to train our own pathologists, which would, I think, help not only with autopsies, but also with procedures that are done here in Anguilla, that we can get, faster diagnosis, which could then lead to faster treatment. Because right now, if an operation is done at the hospital, that specimen has to be sent out to St. Lucia, and it can take a while, even if it's set as stat. It still takes up to 2 weeks to get results back, and it can take months at times. And I think, there's a cost there, but it certainly, slows down the treatment when you have to wait for the pathology results for that length of time. So that's another reason why we should have our own resident pathologist.
Dr. Webster, how soon will the 2022 census begin?
The goal is to start in April for the census. You know, it was supposed to be done last year, since the previous one was done in 2011. And because of COVID, it had to be pushed back. But by April, we intend to do the work, the enumerations and the going out and doing the studies. And then the statistics department is tasked with getting us those reports as soon as possible, so it will inform, how we have to do budgets going forward, the social concerns. There's a lot of information from the census which will be helpful as we go forward to make this country better, whether it's in education, in healthcare, and essential services. I just wanted to add from the, also talking about the health authority, right now government had to put in over $20 million in subvention to the health authority. Health authority budget certainly has gone up because of COVID and other health-related concerns. And health authority itself is not self-sustaining, and so we have to, find the money to put in. $12 million last year was just spent on COVID-related matters, and so you understand there's a lot of concern that in 2020 going into 21 that health authority fees were increased. But if you imagine, if that was not the case, we just put in 20 million subvention, that would probably have been, over $30 million that government would have had to put into the health authority. That doesn't count what the health authority raises on its own. And so these are the concerns that, we as responsible administration have to consider when budgets are made, when policies are put in place. And so it's easy to be on the outside and talk about what is being done. But when you look at the justification, you realize that the hospital doors have to stay open, nurses and doctors have to be paid, essential services have to be done. The police, right now in this new budget, there are certain increases in the in police staffing, which is necessary because we have to be safe, and that is important. Our borders, you see how porous they are, and the police are tasked with keeping the borders safe. So there are a lot of issues. We still on an austerity measures. We don't have the funding, the actual resources. We don't have any reserves. We have policies that we want to put in place that are unfunded that we can't. So when we look at things, I want us to all be objective so that we know that the decisions that are being made, when we're counting, farthings, as Mr. S.A.F.E would put it, pennies, and that is the process. These are informed decisions that are made based on getting the best value for money, and that is that what we are tasked to do and that we will continue to do. So I want all of you to, listen to the budget debates tomorrow and Wednesday if necessary, and be objective in your, your listening and understanding and reporting. Certainly, it is necessary that the people of Anguilla hear from those who listen and can analyze and report objectively. Any other questions? No, I think that's a good place to stop, right, ministers? I want to apologize for the Minister of Economic Development, Information Technology, Natural Resources. He had a hard stop at 3 and he had to leave. Minister for Social Development Education, she had another meeting had to go to, and the Parliamentary Secretary. But just know that if it's a Monday and it's not a holiday, that we'll be here at 2 o'clock informing the people of Anguilla, listening to the questions from the press. And, you know, I want to thank Lloyd's Live, the Daily Herald, Radio Anguilla, the Anguillian. Didn't see, you know, Channel 4 here today, but we wish him a happy New Year all the same. DITES, of course, which stands for Department of Information Technology and E-Government Services. They're always on the job and doing the work. The PRO for this administration, our liaison to the Spanish-speaking community. Thanks, everyone. Thank you, ministers, for being here. And we do wish everyone a happy, safe, healthy, and successful 2022. May God bless you. May God continue to bless Anguilla. Thank you.